We know so many New Mexicans struggle with addiction, and among them, mothers battling postpartum depression.
But could another drug, long viewed as illegal and harmful, actually help? Adrian Rivas explains how a new federal study happening right here in New Mexico might change how you view MDMA.
Errol, why don't you come in here too? Let's both be in this room.
Okay, let's go be group therapists.
Yep.
Walking down an empty hallway, a team of New Mexico health professionals have plans to fill up the new UNM Hospital's Asubi building.
A little bare right now. One of our projects over the next month is to get the room decorated with putting in some artwork and different things. So this is a pleasant, room for the session.
Dr. Larry Lehman is talking about a new therapy program the U.S. Drug Enforcement Administration approved last week.
MDMA-assisted therapy for people who've had childbirth 6 to 12 months ago and have opioid use disorder and PTSD.
Dr. Lehman explains the drug.
MDMA stands for methylene dioxyamphetamine, MDMA. It is something that's often sold, although it may be misrepresented on the street as what's called ecstasy or Molly. It's a psychedelic type of a drug, but it's different from classical psychedelics such as psilocybin in that it really focuses on opening people up. And our hope through using the MDMA-assisted therapy is to treat that trauma, decrease the likelihood of using opioids again, and kind of help set up the mother and the baby and the family, for a life that really what almost everybody who's using opioids wants, which is not to be using and to be able to be there and be fully present for their babies.
15 people will be part of this study. Lehman says this is the first study of its kind, and it's happening in New Mexico.
We are one of the epicenters of the opioid epidemic. We know that our communities have, often collective and intergenerational trauma here, and most of the research that's happened in psychedelic-assisted therapies has happened in, it's happened in Johns Hopkins, it's happened in Yale, it's happened in different places.
Next to Dr. Lehman, Ariel Bowers, a certified nurse midwife, agrees this breakthrough treatment could help many families in New Mexico.
We're hoping to be able to show that this is a viable treatment option and that this is like a beautiful way to help people kind of launch on their journey into parenthood and disrupt kind of the harms that have happened to them in the past.
With recruitment efforts underway, Lehman expects the MDMA-assisted therapy sessions will begin in November. Adrian Rivas, KOB4.